The gentleman from Hanover, Mr. Peace.
Thank you, Mr. Speaker. I rise for a point of personal privilege.
The gentleman has the floor.
Thank you, Mr. Speaker. Mr. Speaker, ladies and gentlemen of the House, this morning a bicameral group of Republican leaders held a press conference to talk about health care in Virginia. I'm not a medical doctor. I did not stay at a Holiday Inn Express. But common sense will tell you that health care is one of the biggest issues facing Virginians in 2016. We can all stipulate that families deserve access to quality, affordable care. The question is, how do we get there? The governor has made it clear that he is once again calling for an expansion of Medicaid, this time by using a bed tax to pay for it. We oppose Medicaid expansion, and Governor McAuliffe knows this. The House has expressed its sense repeatedly on this subject. Why is that the case? Expanding a broken system is not the best way to improve access to care or reduce costs. To expand access to care, House Republicans have an alternative, a solution to health care without expansion. This morning, the group of Republicans that gathered in the House briefing room met and described plans that they'd been working on for several months, several ideas to reform Virginia's Certificate of Public Need law. This effort is overdue, and the time is now. Created in the 70s, this program was designed to limit care in our communities, to restrict access. It has led to increased costs and limited access. If President Obama were giving us this requirement, we might say that it's rationing care. We have a supply problem, and it affects the marketplace and affects families. Amazingly, even the federal government has recognized that COPN laws are detrimental to states. Quoting the Federal Trade Commission, competition in healthcare markets can benefit consumers by containing costs, improving quality, and encouraging innovation. Indeed, price competition generally results in lower prices for and thus broader access to healthcare products and services, while non-price competition can promote higher quality and encourage innovation. What a novel concept. COPN laws suppress these substantial benefits of competition by limiting the availability of new or expanded healthcare services. That's the Federal Trade Commission. Virginia's COPN regulates 19 different aspects of healthcare, including general acute care services, diagnostic imaging, ambulatory, surgical centers, capital expenditures. If you wanted to build a parking lot, a parking deck, you've got to go through the process. Common sense is missing. Virginia's COPN laws are considered the 11th most restrictive in the country, according to a study from the Mercatus Center. This same center and same study also found that compared to other states, COPN laws have led Virginia to have 10,800 fewer hospital beds, 41 fewer hospitals with MRI services, and 58 fewer hospitals with CT services. When a hospital system wants to pursue a COPN to build a new facility to offer expanded service, it must go through a lengthy, costly, bureaucratic process that sometimes can take up to 9 months. I know. I experienced this in my own district, and maybe some of you have experienced the same in yours. I hope that you don't. My district saw firsthand the consequences of this out-of-date program. HCA, I'm sure many of you are familiar with this hospital system, submitted a proposal to build a freestanding emergency room in New Kent County. This emergency center would provide greater access to high-quality care, as well as CT and MRI services. If you've ever driven 64, and I can only imagine this weekend, just think about this weekend and the dangers that lay ahead. But if you've driven to the beach, for example, or the Outer Banks, or the Historic Triangle, you can imagine the constant demand on New Kent's first responders to provide emergency care to motorists in distress. A majority of these patients were transported to Richmond area hospitals in Hanover County, in downtown Richmond, sometimes taking over 45 minutes to get there. When a New Kent family is in crisis, they have to do the same thing. And there's not even a patient first in the county. Access to care is critical, and COPN is preventing families from getting that access to the care they deserve. Back at the end of the summer, early fall, initial state review through the COPN office denied HCA's request. According to health department staff, quote, most of the primary service area of the proposed project is currently well served by existing providers of CT and MRI. And the proposed project would only improve patient access for a small area within Eastern Planning District 15. That's ridiculous. The Richmond Regional Planning District spans the counties of Chesterfield, Goochland, Hanover, Henrico, New Kent, Powhatan, the city of Richmond, town of Ashland. It's a huge geographical area. Their analysis relied on old data and suggested that residents could visit another freestanding ER in Middle Hanover, 45 minutes away, or an MRI, CT service in Chesterfield or Goochland. It defies logic. I want to thank Delegate Orrock, chairman of our HWI committee, for last year having the vision to set in process a study that took place over the past year, supported by Chairman Jones in appropriations, language in the budget that looked to how we would reform COPN. That study was returned, but with modest results. We need to go farther. Ask yourself whether the government should dictate to private industry when it is willing to invest dollars in your community. You know, they are willing to spend money that they may lose. If no one comes, if they build it and no one comes, they're the ones that are out. Why does a state bureaucrat know better than private industry? Shouldn't there be more of a free market process? If this happened in my district, I can guarantee you it can happen in yours. This year, a number of legislators, including myself, have introduced various pieces of legislation to reform the program. We have an opportunity now to enact smart, innovative, and meaningful reform that will increase access to care and reduce costs. It is time to remove the unelected government bureaucrats from making decisions for medical providers about what services are offered in local communities across the state. Families want choices. We should not continue to limit medical choices simply because of an outdated law is still on the books. The legislature, I think we know, will always be slow to catch up to innovation in the private sector. You know, just last year we had Uber, a disruptive idea that was legalized, was allowed to come in to Virginia, and DUIs are down. This year we've got Airbnb to provide more choice in the marketplace. We also have COPN reform, which I would suggest is just as disruptive, just as next generational an idea whose time has come. It's the 16th year of the 21st century, and it's time that we join it, and we pass meaningful, smart, and innovative COPN reform. Thank you, Mr. Speaker.